Thank you very much, Ms. Forrest. It's really a great pleasure to have the opportunity to do an educational webinar on a very important and very interesting topic, which is blood clots and cancer. And it's particularly a privilege to be able to speak to patients, and more specifically cancer survivors, given that I'm an hematologist, I'm a blood doctor, and I subspecialize in blood clots, and my special interest is blood clots in the setting of cancer. So it makes this event very, very special, and I'm very thankful to the Canadian Cancer Survivor Network for putting through this event, to Leo Pharma for sponsoring it, and to Thrombosis Canada for helping with the logistics and the promotion of the event. I'm a member of Thrombosis Canada, and it has a lot of good patient-oriented resources as well that I'll come to in a minute. So thank you for this opportunity. I really hope that the session will be interactive. This is a session for you guys. I'm happy to entertain you for the first 20 to 30 minutes on blood clots in the setting of cancer. But as you all know, you have a way to ask questions, so please feel free at the end. If you have any particular questions that you would ask, or if things were a little bit too complicated, things you didn't understand, please feel free to write a few lines, and I'll go through the questions at the end of the presentations. So I will try to make this as understandable as possible, but it's complex for all the healthcare professionals, so please feel free to let me know if you have any additional questions. So as Ms. Forrest mentioned, this is a special day today because it's the World Thrombosis Day, and you're probably wondering why the World Thrombosis Day is on October 13th. Well, October 13th was the birthday of a pathologist called Rudolf Virchow, who really was a scientist, and then back in Europe really helped to understand venous blood clots, and really helped to promote and make advances in the science and the research around blood clots. So it's really to his honor that we've been using his birthday as the World Thrombosis Day. The World Thrombosis Day is at its third year now, and really the overall aim is to increase global awareness to thrombosis, because as we'll see, thrombosis can lead to mortality or death. It can lead to significant disability, and we want to create awareness. Unfortunately, these venous blood clots, they're not as sexy as heart and stroke or arterial clots. Sometimes patients or the general public or even healthcare professionals haven't heard too much about these venous blood clots before. So really the World Thrombosis Day is trying to increase awareness and really helping patients to engage in a discussion with their healthcare professional about their underlying risk of clots, if anything can be done to prevent it, and really importantly to discuss signs and symptoms so that people can seek medical attention if they occur. So within 3 years, they've been able to regroup about 600 organizations in over 80 countries. So it's a phenomenal what they've been able to accomplish within the last few years. So, and it's a great pleasure again to be able to talk to patients on this special day. So I'll start by talking about blood clots in general. It's always good to start where I have a definition of the disease we'll be discussing. So venous blood clot or venous thrombosis usually develop in the deep veins of the leg, and they're usually called DVT or deep vein thrombosis. Sometimes they can also occur in the arms, especially if there's a catheter in place, like for example a PICC line or a portacat or a central line that's often used to give chemotherapy, for example, or for taking blood. So these venous thrombosis often happens in one of the limbs, but more frequently in the lower limbs or in the legs, and sometimes in the arms as well. Now, sometimes these blood clots, they can get worse over time, especially if they're left untreated. They will grow, and eventually they will, branch off, and then they will travel. And when they do travel, then they get stuck in the blood vessels of the lung, and that's called a pulmonary embolism, or PE. And a PE is really a blood clot that traveled from the leg, as you can see on the cartoon on the right-hand side, traveled from the leg into the blood vessels of the lungs. And the DVTs and the PEs really are just clinical manifestation of venous thrombosis at the two ends of a tube, right? It starts in the lower limb, it can get worse and travel, get stuck in the lungs. They don't go anywhere else. They don't go on the arterial side. They usually don't travel to cause heart attacks and stroke, for example. They really are more on the venous side, but they remain very important to diagnose and to treat, because untreated venous blood clot will lead to death or mortality in about 1 in 3 patients if left untreated for a long time. So because they're just the clinical manifestation of the two ends of a tube, often doctors, nurses, pharmacists, healthcare providers, when they talk about venous thrombosis, they call it VTE for venous thromboembolism, and most often they combine both. They combine the lower limb DVTs and PEs. So during this presentation, when I'm referring to VTE, in general, it means for venous thrombosis, venous blood clots, and it's combining both lower limb deep vein thrombosis and blood clots in the lungs or pulmonary embolism. So your probably the first question that you probably have on your mind as a patient is, are blood clots really important? And it looks like they are very important. Venous thrombosis is a leading cause of death and disability worldwide. Around the world, about 10 million cases of VTE will occur per year. And if you look in Canada alone, that's 45 to about 50,000 patients or Canadians that will have a deep vein thrombosis or a pulmonary embolism. Now, they're all also associated with high mortality. If you think about it, these blood clot related events kill more people than AIDS, breast cancer, prostate cancer, and motor vehicle accident all combined. So it's really associated with a high mortality, and that's why it's important to discuss the signs and symptoms so that early diagnosis and adequate treatment is established right away. Now, obviously, we're cancer survivors, so the next question now, well, Mark, are these blood clots frequent in cancer patients? And the answer to that is yes. They're actually more frequent in cancer patients compared to the general population. So having a diagnosis of cancer alone will increase your odds of having a blood clot by about 4-fold, and cancer in combination with chemotherapy will increase it by about 7-fold. And when we have cancer during our cancer journey, there's different times where we have additional risk factors. So really, the risk of these blood clots to occur in a cancer patient is very high. There's no doubt that certain tumor types are more likely to have cancer, and certain types of chemotherapy are harder on the veins and are more likely to cause blood clots. But in general, cancer alone and cancer in combination with chemotherapy will be enough to increase the odds of having a blood clot. Now, what you're thinking is probably, well, Mark, that's fine. These blood clots are more common in the setting of cancer, but is it for me to know, or is it translating to, patient important outcome or things that I want to avoid? And the answer to that is yes as well. So blood clot is the second leading cause of death in cancer patients. And if you look at the chart pie on the right-hand side, you see that cancer progression is the #1 reason why patients eventually die. But when you look at #2, you have blood clots in second place, equal with infection. And although these are two very important clinical states, I think there is certainly more awareness for infection. And by that I mean that I'm sure that as a cancer survivor, you've heard about febrile neutropenia before, or fevers after going chemotherapy. So most cancer patients, when they go for their chemo teach, or when they have discussion with their doctor, nurses, or pharmacists when they're receiving treatment, there's often a discussion about, if you feel unwell after chemotherapy, you have to take your temperature, and if there's fever, then you need to give us a call, seek medical attention to your healthcare provider, or go to the emergency room, because this could be very important. You need to be treated with powerful antibiotics and supportive measures. Now, equal to that, is blood clots, and I would challenge that most of the cancer patients on the line, most of the cancer survivors, are probably not aware of the signs and symptoms of these blood clots, so DVTs and PEs. And they're as important as febrile neutropenia. So I think it's important from an overall World Thrombosis Day or an overall health practitioner point of view to really have a discussion with patients about them, to really have a discussion about the signs and symptoms so that patients can seek medical attention when they need to. And just to reflect that a little bit more, I've put there that the annual death rate for blood clots in cancer patients is 47-fold increase compared to the general population. So if you have a PE, for example, and you have cancer, your chance of dying of that cancer, of that PE, is 47-fold increase compared to the general population. And the reason probably for that is because cancer patients sometimes are ignoring the symptoms, not ignoring, but they're not necessarily aware of these symptoms, and they have all sorts of side effects, and they may think these symptoms they're feeling or the way they're feeling is related to the underlying chemotherapy or anti-cancer treatment or their underlying disease, so they're not as proactive as seeking medical attention. So we'll go through the symptoms and the signs together, and hopefully that will help in that matter. Now, blood clots can also lead to disability or decreased quality of life in other ways. So the DVTs or the blood clots in the legs often will lead to valve damage in the lower limbs, and therefore a third of the patient, even if they have good treatment, will eventually have long-term complication, things that we call post-lytic syndrome, which is really chronic lower limb swelling, dull achy pain, leg heaviness, and skin changes. But you can see that if you have to deal with that on a daily basis, it can really affect your life. And a small proportion of patients with PEs or venous blood clots in their lungs will eventually, despite good treatment, will have chronic shortness of breath, unable to walk long distances, intolerance to exercise, etc. Meaning that it's really important to do the diagnosis early, because as soon as we start treatment, and effective treatment, we can reduce the chances of having these long-term consequences of having blood clots as well. So there are a number of risks associated with venous thrombosis. For example, patients in which their cancer is growing or has spread to multiple sites, that will be a higher risk of developing blood clots. If a person is receiving chemotherapy or having surgery, for example, these are also associated with increased risk of there's any other medical complications. Sometimes when we have additional infection, sometimes it's a matter of accumulating small risk factors that'll make you go through the threshold of having a symptomatic event. So it's important to know these risk factors, because when you go through them in your cancer journey, or when you're accompanying patients through their cancer journey, you need to keep in mind that these might be a higher risk situation, and evaluating the risk or having a discussion for at least discussing signs and symptoms will be important. Now, there's other risk factors that patients can work on, or that we can work on as an individual. So these smaller risk factors would be obesity, smoking, alcohol consumption, and not moving enough for a long period of time is also a risk factor. And these things you can work on. So you can try to lose some weight if you're overweight. You can stop smoking, stop drinking, keep yourself hydrated. Sometimes we're not feeling like going out of bed too much because we're going through so much. But even if we're not going out of bed, sometimes doing exercises, contracting the calves, or doing leg exercises, or just moving the legs in the bed might be helpful, because that will prevent venous pooling in the lower limbs. And then when we're in bed for a long time or don't move for a long time, then the blood is more prone to clot because of the pooling. That can lead to blood clots, and then these clots can travel to the lungs, and then there's more trouble. So these things are important things that, as healthcare professional, we should remind our patient, that you should remind yourself to work on it, to try to avoid it as much as possible. Now, of all this, hospitalization is probably the most important risk factors, and in fact, up to 60% of all VTE cases occur while patients are admitted or within 90 days of hospitalization, making it the leading preventable cause of hospital death. And that's probably the reason why that if you had any complication during your cancer journey and required hospitalization, and maybe you received small doses of blood thinner through an injection on your belly on a daily basis. Maybe we did put some compressive stockings on you, or sometimes we put these boots that will also contract the veins. And the rationale for that is really to try to minimize the risk of having these venous blood clots on the long term. And some of you might have also be discharged from a hospital with these needles, especially if you had surgery. Sometimes we like to continue them a little bit longer after hospitalization, and that's really to try to prevent these blood clots from happening. So sometimes when patients are in high-risk situation, physicians try, and pharmacists and nurses try to minimize that as much as possible. Now, it is very important for folks living with cancer to know the signs and symptoms of blood clot because, as I mentioned before, they can sometimes be very subtle, and many other conditions can cause similar symptoms. And often when I talk to my cancer patients, when they have their clots, they said, you know, Mark, I used to think this was because, you know, my underlying tumor or because I was getting side effect from my chemotherapy. But really reviewing these signs and symptoms, it's important. And so it's important to see your doctor quickly if you get any of them so that special tests can be done and to make sure that you don't have a blood clot, or if you do, then you actually get good treatment, adequate treatment right away. So when deep vein thrombosis occur, the clot will cause blood flow coming back from the leg to stop or slow down. So there's like a backup. So remember, as soon as you put your feet down in the morning, blood will go down the limb, and high pressure arteries is trying to come back up in the low pressure veins, and this is where these venous blood clots occur. So it's like there's a traffic jam coming back up to the body, more or less. And because you're on your feet or sitting up, with gravity, the fluid will go down the limb. So people always start to, sometimes start feeling more swelling, or more pain around the ankle at first, because with gravity it goes down the limb, and then to the calf as well. Some people will describe some cramping, some Charlie horses that are not going away. Sometimes there's some redness associated with it, or sometimes the skin will also change color, or you have a sensation of having a heavy leg. These symptoms don't come and go. When you have a deep vein thrombosis, these symptoms will just progress over time, and it's important, as if you have these symptoms, they're not going away, really to seek medical attention right away. I've said before that if the DVT is in the arm, similar symptoms will happen. Some folks will complain about aching in the shoulder, the whole arm, sometimes in the neck. Sometimes you might notice some of your veins on the back or on your chest or over your hands will be popping out. If the DVT is occurring because you have a PICC line in place or a catheter in place to help with chemotherapy or venous blood drawn, and then the catheter may not be working properly, it may become more difficult drawing blood from it or infusing your medication or fluid through it. So these are all signs, symptoms of potential clot, and if you have them, then please tell your healthcare providers. Don't wait until the next appointment. It's worth to have a call to your PDN nurse, your doctor, your pharmacist, or your primary care doc to have a discussion. They will be able to help you in deciding if these are important and needs to have more special tests to rule in or rule out having a blood clot. Now, when PE, remember these are blood clots in the lungs, when they occur, well, the clot is blocking blood flow from the lungs. So often people are describing difficulty breathing. They're more short of breath. They're more short of breath when they're doing their usual stuff. They said, Mark, I used to be able to walk up a flight of stairs. I can no longer do it. Or I was doing this type of exercise, and all of a sudden I was really short of breath. Or when I was carrying my groceries or doing any day-to-day chores. So people often present with the shortness of breath because the blood flow is blocking the blood clot is blocking the flow to the lungs. Some other patients may get chest pain. The pain is usually very sharp, stabbing pain, and typically it's worse with deep breathing. Sometimes it can also feel like a pressure on your chest. So it's important that if you have these symptoms again, you need to seek medical attention right away. When a clot is larger and it blocks a larger vessel, then there's a lot of part of the lungs that no blood flow, then you may feel lightheaded and dizzy. And obviously, if you have any of these symptoms, then you need to ask someone to take you to the emergency room or call 911. You don't want to delay seeking medical attention because PE is a medical emergency and can be fatal. And if it's not a PE, well, it might be another underlying diagnosis like a heart attack. So if you have any shortness of breath or chest pain or loss of consciousness, it's really important to seek medical attention. It sounds very intuitive when we talk about it in the presentation, but on a daily basis in my clinic, when patients are diagnosed, I go back and I ask the history. A lot of time they ignore their symptoms for a long time. So it's really important to seek medical attention right away because adequate treatment is very effective and that can actually save lives. So I cannot emphasize that more. Now, often patients will say, well, Mark, what can I do to prevent these blood clots from happening? Well, the first thing I do, or I say, is open up with your healthcare professional and have a discussion about it. You don't need to have a discussion every day or being very anxious about blood clots, but there's certain times, as I mentioned, in the cancer journey where you'll be you'll be at a higher risk of developing these blood clot complications. That would be, for example, if you're admitted for a short course and need to be in the hospital for a complication of chemotherapy, for example. We mentioned fever in the setting of having low white count. We mentioned having surgery or procedure. Ask your doctor if the risk is high enough, and if so, then they'll talk about measures to do it. And these could be, for example, anti-clotting medications, so blood thinners. They're referred as anticoagulant. And when you're admitted to hospital, they'd be given under the skin, like a small injection under the skin, and I'll come back to that as well in a few slides. They can also say, you know, you're not that high of a risk, or you're also at a high risk of bleeding, so we prefer to use a mechanical device. And that could just be compressive stockings, so stockings that you put on your legs. They're graduated, so they avoid having pooling of blood in the lower limbs, and they push the fluid back up, so it diminishes the risk of having blood clots. Or they can say, well, we want to put intermittent pneumatic compression devices, and these are the boots that I mentioned earlier, where you put the boots on and then it contract the calves at different pace, and it helps venous return and having too much stasis in the lower limbs. But what's more important is the prevention that you can do on your own. You can empower this and avoid known and modifiable risk factors that we talked about. Keep yourself hydrated, avoid smoking, alcohol, lose some weight. And as we mentioned before as well, it might be good to try to move around as much as possible when you're admitted to hospital, but sometimes that's not possible. And if not, then do foot or leg exercise as soon and as often as possible. And as I mentioned, this will avoid having venous pooling, will avoid having the clot having this tendency to clot and to travel afterwards. So a lot of things that one can do to prevent them. But sometimes we cannot prevent these blood clots and they just happen. But when they're diagnosed, the treatment is very effective. And in persons living with cancer, the usual recommended treatment for these venous blood clots is an injectable blood thinner called lomaquate heparin. This is a drug that is given with a small needle under the skin. They come in preloaded, pre-filled syringe. They're very easy to use, and you can see them very much like giving insulin in patients that have diabetes. So very small needle, very easy to use injection. The injection is usually once a day, and really the dose depends on your body weight and how well your kidneys are working. So your healthcare professional, your nurse, your doctor, your pharmacist can easily calculate the dose you need. And there's different brands available on the Canadian market, so we can find the right pre-filled syringe for you. Now, what will the low molecular weight heparin do, or the blood thinner do? Well, it will stabilize the clot. It will make sure the clot is no longer growing, not traveling, causing more trouble, and then your body will slowly degrade this clot over time. Your body will have everything it needs to degrade this clot over time. And the reason why I'm saying this is when you start the blood thinners, when you start the low molecular weight heparin, you wouldn't expect to see a difference from a day to day. You won't feel better, or the symptoms won't be completely disappearing by the next day. You need to be patient with the symptoms, and it's a week by week difference. So often what I say to my patient, when we see each other next week, you'll start feeling better. And the low molecular weight heparin also has anti-inflammatory properties to them, so it helps to make the patient feel better sooner as well. Now, as I mentioned, the blood thinners will stop the clot from growing, traveling, but your own body will degrade this clot slowly over time. So once you start treatment of the blood clot, you'll need to continue for at least 3 to 6 months. That's how long it takes for the body to get rid of the clot over time. If you do a shorter time period, it means that the likelihood that the clot will come back or that a second clot will appear will be higher. And your doctor will see you after a few weeks and make a decision with you, of course, on when to stop the treatment. The decision will depend on what's happening with the cancer, still underlying cancer or ongoing treatment, and what type of treatment you're doing, and how well you've been tolerating the injection and the risk of bleeding, of course. So that's a decision that is made on a case-by-case basis with your physician. Now, as I mentioned with the low molecular weight heparin, this is just a few pictures to show you. There's different brands available around Canada. So tinzaparin or Inahep, dalteparin or fragment, enoxaparin or Lovenox. They're all given through a small injection, similar to what you see the bottom right-hand side of the slide. Very easy to use and usually given at once a day. Now, you're probably wondering, well, Mark, that's all good, but what if I don't want to use an injectable form of a blood thinner? Well, if you don't want to use injection therapy, there are other options, but they don't work as well as the injections. There's a number of clinical trials that have compared the oral blood thinners to the injectable low molecular weight heparin, and the injectable ones are more effective and safer. And that's what clinical practice guidelines or recipe cookbooks that doctors and nurses and pharmacists are using are currently recommending. It would be to use the injectable form of a blood thinner as a first line. Now, you might have heard of Coumadin or warfarin in the past. Warfarin is the old standard of anticoagulation. It's still used for treating blood clots in some cancer patients. It's taken by mouth, so it's a pill, but it can be very high maintenance. And the reason for that is because warfarin will interact with all sorts of foods, and it has a lot of drug-to-drug interaction, especially with chemotherapy. So each patient will need a different dose, and that dose may change depending on your diet and depending on interaction with medication. And the only way to know what pill strength or the dose that you will need is by doing blood work. So often, because when you're battling cancer, you don't necessarily have a very stable diet. Some days you're feeling like eating more or less. Often you're getting chemotherapy in cycles every second or third week. So it's really hard to control warfarin, and often patients need very frequent blood tests in order to do so. And this can be hard to manage if you're living with cancer, but that's something that can be considered. Some people are watching the American channels, and we have folks from the U.S., and they're saying, well, I'm seeing ads on TV of all the time with newer pills that are available that says are replacing warfarin. Can I use them in the setting of having blood clot in the setting of cancer? Well, as you know from the from the internet and from these TV ads, the newer pills work like warfarin, but don't require dose changes or blood work. However, they haven't been tested properly in patients with cancer, so for the time being, they're not recommended. They may have interaction with some chemotherapy, and there's other things. So clinical trials are ongoing, and hopefully soon we'll have a little bit more data about the use of these blood thinners if they are as effective and safe in the setting of cancer. But for the time being, they're not recommended as a first line when you have the new diagnosis unless you're kindly participating in a trial. But your doctor will be able to help you throughout the journey and making sure that you're on the right blood thinner at the right dose over time. And obviously the blood thinner will be stopped when it's no longer required, depending on the site and the extent and the chances of having a second one. So we've been talking for a good half hour here, so let's get the interaction going. What I wanted to cover over the last 30 minutes with you is to remind you as cancer patients, cancer survivor patients, that blood clots are common in patients with cancer. They are associated with mortality if they're not diagnosed early and started on adequate treatment. Prevention is important. There's things that your healthcare professionals can do. There's things that you can do as well to prevent these clots from happening. And again, the recognition of the symptom is really key, because if you know you have the symptoms, you talk to your healthcare professional about it, then it will lead to early diagnosis. It will lead to initiation of effective blood thinners that will avoid having complication and also having these long-term chronic consequences or complication that we've described in a previous slide with the chronic swelling and the chronic shortness of breath that sometimes is hard to get used to. Right? So on that note, I will finish now and open the floor to discussion. Maybe the one last thing I wanted to cover before finishing is there's a number of very important patient resources available. If you want to have a bit more information on blood clots, if you want to talk to patients that had previous blood clots. So the first one I've listed here is Clot Matters, and it's a patient site, and they're really thrombosis advocates. The Canadian site's really well done. Martin Amur is the patient advocate for a number of organizations, including Thrombosis Canada and CanVector. He's doing a fantastic job. So this is an important resource. If you have a new diagnosis of blood clot and you want to learn more about it, Thrombosis Canada has a whole section on patient education. It's free, so you can just go on thrombosiscanada.ca and look for the different patient information booklets and different patient information sheet that we have. There's a lot of resources available. And obviously World Thrombosis Day also has resources for patients, for healthcare professionals, and for partners, so you can go on their website and have a lot of different tools that one can use in their clinical practice, but also as a patient to learn about the disease and how to prevent it. So on that note, I'll finish now here, and I'll just have a look to see if there are any questions or if there's any concerns or suggestions or comments on the presentation.
I might just jump in here, Mark.
Yeah.
I'm not seeing any questions on my end yet, so I just want to remind everybody that there's a questions box in the GoToWebinar control panel, and if you don't see it, there should be a little kind of orange arrow up at the top right of your screen that you can click, and it will bring up the entire control panel, and in there all the viewers should see the questions box that they can type in their questions there and ask anything about the presentation so far. So we'll just, I'm still not seeing anything yet. So Mark, I'll pass it back over to you, and we'll hopefully get some discussion going here, because it's a very, very interesting topic for sure.
Thank you, Matt. And then if you prefer to ask your question privately, you can also feel free to send me a mail. I'll be happy to have a look at it. I get a number of emails per day. I'll try to get to it for sure. It may take me a couple of days, but if you have any specific questions, I'll be happy to entertain them for sure.
Mark, I just want to ask a question. Are there other chronic diseases that may be comorbidities with cancer which would affect deep vein thrombosis?
Yeah, so sorry, so the first part is what type of disease, other diseases, is that what you said?
Yeah, so some people with cancer may have, kidney disease or some other
Mm-hmm.
chronic illness, and how would this
Yes,
be affecting deep vein thrombosis?
right. So, well, thank you for your question. It's an excellent question. It will interact at all sorts of different ways. So, for example, if we look at risk factors, there's a certain number of conditions that will increase your underlying risk of having a venous blood clot during your cancer journey. We mentioned obesity for sure is one of them. But if you have a prior history of having these clots, we've been focusing on cancer patients, but they happen all the time in all sorts of patients. So if you have a prior history of these clots, you'd be at higher risk of having clots as well. Some people are born with, we didn't have the time to go through all the details, but some people are born with genetic and acquired tendencies to have these clots, so that would be an important risk factor to consider as well. And then some of these comorbidities will also affect the treatment. And you mentioned function. That's a good one because sometimes as we get older, the kidneys are not working as well as they were before. And it's important for all the blood thinners to have good kidney function in order to make sure we don't accumulate over time. So depending on the kidney function and your weight, you'll be on a certain dose. Let's take, for example, low molecular weight heparin. You'll take certain dose of low molecular weight heparin. Not all low molecular weight heparin are the same. Certain low molecular weight heparins in Canada are larger molecule, and when they're larger, they don't tend to need as much elimination by the kidneys, and therefore they might be safer. So there's certain things that your physician or pharmacist will decide based on your kidney function. They may decide on a certain brand of low molecular weight heparin over another, or a certain dose over another one. So there's certainly different things that will modulate the with the prevention, the diagnosis, and eventually the treatment. So things are always a bit more complex in the setting of cancer, and there's a number of clinical challenges that clinicians have with cancer patients because, as you know, in the setting of cancer, you're more likely to have low blood counts, and that would include low platelets, which are important for not bleeding. So managing blood thinners in patients after chemotherapy is a little bit more complex, and that might decide on the type of blood thinner and the dose of blood thinner that one would use. And similarly, cancer patients sometimes have a tendency to be so prone to clot that he may have more than one clot, and that's despite being on the small dose of blood thinner. So how to manage these patients is a little bit more complicated. So there's a lot of different variables that one can put into it that will complicate things for sure. But most doctors and pharmacists and nurses would know how to manage these, or if they don't, then they would know who to contact to help out with the management plan. Thank you for your question. Well, if there are no other questions, as far as should I give this back to you and people can contact me directly if they have additional questions?
I see
Yes,
one
thank you very
here.
much, Mark.
It's a
I
pleasure.
see
Thank
one
you.
just
I'm
asking
not
what
seeing it.
what
Go
your
ahead.
email is. Dale
Uh,
is asking what your email address is, Mark.
okay. I'll write it down so that people can email me directly. Thank you.
Okay, again, people can send further questions over to Dr. Mark Carrier. Thank you, Dr. Carrier, for joining us today. Stay tuned, everyone, to our website at www.survivornet.ca, where you can sign up for our e-letter for other opportunities to join other webinars. This webinar will be available online tomorrow. There will be a full video on YouTube, as well as slides which will be on our SlideShare account. Links to both will be sent out to all attendees registered tomorrow afternoon, and the links will be available on the opening page of our website. Thank you again to Thrombosis Canada and to Dr. Mark Carrier, and have a wonderful afternoon, everyone.